first I'm going to introduce the coalition. We're the National Prevention Science Coalition to Improve Lives, and we sponsor these briefings every couple of months. Neil Woolman and I are the co-directors. Dr. Woolman, and he'll speak a little bit later about something that we'd like you to know about. So we're the co-directors, and it's a coalition that's made up of about 450 members now and growing. We're made up of scientists from across the disciplinary spectrum, as well as clinicians and practitioners and educators, community organizations and stakeholders, as well as advocates and policymakers, and pretty much across the board, across what I call the translational spectrum of bringing research to practice and policy. We also have a number of affiliations with national organizations and federal agencies that are very active in our organization. And we have about 38 of them right now, and also growing. Not yet. Yeah, and so as a collective body, we offer expertise and advice in public and private sectors. And again, try to infuse the science into our decision-making broadly. Okay. You're off the clock. This is our mission, to prevent social ills and promote well-being by translating scientific knowledge into effective and sustainable policies, systems, and practices. And this wheel here is reflecting the sorts of ways that we attempt to facilitate the transfer of information, so that we are bringing basic science all the way through to practice and policy. Our goals are to achieve socially significant outcomes. We work in, these are our primary goals, and we work in these capacities. We have subcommittees and so forth, and we, in our science committee, we are trying to encourage interdisciplinary teams of scientists to bring together a lot of different types of information, disciplines, and methodologies, so that we can understand the conditions that lead to mental, emotional, and behavioral conditions, and also to look at the factors that underlie intervention effects, so we can better develop interventions that will work better for more people, so they'll have the greatest impact by understanding the mechanisms by which they work. We also work on implementation and systems change, so that we can drive the way science-driven practices are implemented with great rigor, of course, and systems change and interagency involvement is necessary in this process. And then finally, advocacy and policy. Sorry, I have to keep turning my head, it's a little awkward. Practice to promote government adoption of a prevention model that's based on science. In this particular briefing, we'll be talking, as I said, about reducing poverty and its adverse consequences. In the coalition, we have expertise from across the board. I like to call us the Verizon Network, in that we have a lot of capabilities, and we're sort of everywhere with respect to this aspect of science. And this is very timely because recent events have suggested to us that there are a lot of things going on in many of our cities and even in rural areas that really harken back to poverty. That much of the strife that we see in our country really has a source in poverty. And there are evidence-based practices that are available that can make it done, and that's what we'll be talking about today. And we also want to recognize the role of trauma and developmental issues in the effects of poverty on children and the impediments that they pose for children succeeding in life. So just to refer back to the Institute of Medicine report in 2009, which we cite often, the one factor that keeps lurking in the background, this is sort of a quote that I unpackaged from the IOM report, that lurks in the background for all emotional, behavioral, and mental disorders and antisocial behavior is poverty keeps coming into the equation. And it entails a range of hardships and a number of factors that can contribute to these disorders that we need to recognize and to target in whatever we do to attempt to ameliorate the effects and to discontinue the exposures to the extent that we can. And there are changes in social policy that can reduce these risks, and we'll be talking about that today to some extent. And we do believe that the future of mental health in this country, in large part, depends on how we collectively address poverty.